Yo, 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 what's good, man? It's your boy Nurse Akeem, and I am a Psych NP in the making. How y'all doing today? What's good, man? I'm back with another reaction video, you dig? So, me being a psych nurse or whatnot, I wanted to go back and look at the past of what used to be did for psychiatric disorders. What did they used to do? And today, my mind say, just do a video on lobotomy. So, we finna check it out, lobotomies, and how crazy it is. Where I work at, I haven't did a video about that, but they have like a museum, and this museum, it has skulls of babies, couldn't have been no more than 10 months or a year old, with holes in their cranium from where they used to do lobotomies to babies. So without further ado, let's get into the video.
I will perform transorbital lobotomy on 10 patients within an hour.
In the 1930s, a new brain surgery, like the one portrayed here in the movie Francis, was brought to the United States, the lobotomy.
Only a little more dangerous than operating to remove an infected tooth.
You see the thought process of doctors at the time? He compared actually going into the frontal brain, poking holes in it, no different than removing a tooth, which is ridiculous. Like, gotta be ridiculous.
It was performed on mentally ill patients all over the country,
Lobotomy gets them home.
hailed by the media as a miracle cure.
Life magazine, the New York Times, Time magazine, they loved it.
Lobotomy was felt to be mainstream science. It wins the Nobel Prize.
But more than 40,000 surgeries later, the brutal truth about lobotomy would come to light.
They were basically going in and mushing around brain tissue, and unfortunately, in many cases, leaving patients worse off.
7 decades later, a look back at the lobotomy story shows how far our understanding of the brain has come and how far we still have to
Yo, I ain't even gonna lie, y'all. It's hard to watch this, man, with that thing in it. Like, it's really hard to watch.
go.
Alright, y'all, let's go. Let's get to it.
In the early decades of the 20th century, people struggling with mental illness had few options.
Families were at their wits' end, didn't know what to do with people who had lots of mental symptoms. Institutions were very overcrowded, and the treatments were very, very difficult, like hydrotherapy, where people would be immersed in water,
Yo, I was looking at nurse. Well, I think it's on Netflix called Ratchet, and I find this very fucking, excuse my language, crazy with the hydrotherapy or whatnot. They would it was a woman on there, and she was a lesbian. Yo, the doctor prescribed her the hydrotherapy. They put her in a hot chamber, turned the damn water up, and pretty much damn cooked her. Took her out there and put her in some ice and cooled out. Man, you can't do that to fucking nobody now, man. That shit called shock or some shit. Excuse my language, but that's fucking mad crazy, yo, just for being.
insulin therapy, where the doctors would make the patient's blood sugars go down to 0, and they would have seizures.
In 1936, a new surgical technique called lobotomy began to be used. The experimental procedure, which partially severed the frontal lobes from deeper parts of the brain, was said to calm and even cure those struggling with mental illness.
Dr. Walter Freeman and Dr. James Watts, who was a neurosurgeon, were claiming that they had great success, that they were restoring a good life to people who had been suffering, and they had become famous.
One of Freeman's many skills, was cultivating the media, and they reciprocated with a lot of very favorable coverage. Miracle cure to the brain, cutting the brain cures the soul.
I'm sure
The media was all over it.
In 1941, Joseph P. Kennedy, the patriarch of that prominent political
he looked like he's a perfect candidate for a damn lobotomy.
family, read about the surgery and contacted Freeman and Watts about his eldest daughter, Rosemary.
Rosemary was slower to walk and talk. As she grew, it became more and more obvious that Rosemary could not really move beyond, say, a 3rd or 4th grade educational level.
Being at the table, she wasn't up to the complicated conversation we'd have, other political discussions.
In her early 20s, her mental health issues were really becoming a problem. The tragedy is many other doctors at the time recommended against this procedure. They agreed that it was too experimental.
But that's kind of like today we have people vaping and shit. A lot of people vape, but we don't have enough evidence to support is vaping good versus smoking regular cigarettes.
At the age of 23, Rosemary Kennedy was lobotomized. The surgery did not go well.
They cut too deeply into the brain fibers, and Rosemary became disabled.
She did eventually regain her ability to walk and talk, but she lost a lot of what was in her personality. There should have been a terrible setback for lobotomy. It wasn't.
With Rosemary Kennedy's failed surgery hidden from the public, Freeman would ultimately break with his surgical partner and take the procedure even further.
The simpler approach to the frontal lobes through the roof of the orbit.
Inspired by an ice pick from his kitchen drawer, Freeman would use a surgical pick to enter the brain through the patient's eye socket. He claimed that this could be done by anyone, anywhere in a matter of minutes. And to prove it, he took his new procedure on the road.
Now, these things that were being done were nothing like what we might.
Man, let me see something real quick, like. So low. Let's see, lobotomy cost. Let's see how much them damn things costed. In let's say 1940. Let's just say 1940. Damn, look. We don't even know. Damn. It's so dark, yo. We can't even find a price.
Think of as modern evaluation of treatments like a randomized controlled trial. These were just patients who were sick with mental illness, who got a lobotomy.
And it would be used for a whole host of ailments.
Hallucinations, obsessive behaviors, feelings of depression and suicide, soldiers returning from the theater of war with anxiety and behavioral problems, people suffering for what was then called intractable pain.
Arguably, one of those patients was Anna Ruth Channels. Channels had suffered from severe headaches for several years, and Dr. Freeman was sure that a lobotomy was the cure. Carol Duncanson is Anna Ruth's daughter.
Walter Freeman promised she would just be happy. Everything would be fine. And who wouldn't go rah-rah for that when you're hurting so badly?
Dr. Freeman lobotomized Anna Ruth when...
See, 3 months ago, I told you, man, that this is a state hospital in Florida. They have babies, literal babies. They're a corpse. Their skeleton with holes in the brain.
Carol was 3 months old, and in a cruel twist of fate, her headaches were gone, but so was almost everything else.
When they brought her home, she did not know how to do the activities of daily living, even the most basic things like toileting and bathing.
My baby knows.
My aunt taught her from the very beginning. She wasn't the mother that I would ever describe as being motherly.
Carol says because her mother was unable to care for her, that she and her sister would spend part of their childhood living in a series of foster homes.
I'm told that Dr. Freeman went to West Virginia and interviewed my mother after the lobotomy, and that he considered her outcome excellent.
Wow. Excellent.
That's probably the most insulting thing I've ever heard.
In the mid-1950s, treatment for the mentally ill would begin to change dramatically as antipsychotic drugs came on the market.
They weren't perfect. They had a lot of side effects, but they worked for a lot of people, which left lobotomy in an interesting place. I mean, why would I burrow into someone's brain if I don't have to? But some still felt that lobotomies were indicated. One of those.
Is Thorazine for? I think that's for alcohol, right?
Those people was Walter Freeman.
There was a number of children who received lobotomies at Freeman's hands. He recommended lobotomy for a young boy who was having trouble in his family getting along with a stepmother.
In 1967, Freeman would be forced to stop performing lobotomies when one...
On another note, 1967 is when my mother was born. So just imagine that. My mom's not that old.
One of his patients died while having her third operation.
Damn.
In all, he had done more than 3,500 surgeries in 3 decades.
Guarantee he was
He
a
died
millionaire.
in 1972, but his radical procedure had taken hold in popular culture.
There's only one little operation they perform here. It's on the brain. It's called a lobotomy.
I think the way culture has dealt with lobotomy
up.
might
Boy,
be
that's really
in
fucked
sort of a
was-
simplistic way.
Hey, she looked deranged when she was looking at him.
Evil doctors experimenting on patients and creating all this havoc and disruption.
When Hollywood, you can guarantee this now. When Hollywood get a hold of that, it ain't never a good look when Hollywood.
Great legacy of lobotomy would be to understand why lobotomy was so exciting at the time. People were enormously upset about the mental illness that they saw that they couldn't treat otherwise. They were excited about the possibilities of new technology. I think we can see how many of those factors are still at play today.
While people struggling with mental illness now have more choices, from new medicines to the more unconventional,
TCA,
like the use of
MARIs.
LSD for post-traumatic stress disorder, for some, the treatments still don't work. But with the Brain Initiative, scientists are hoping that advancing technology will help them understand the brain in ways once thought unimaginable.
President Obama unveiled a $100 million initiative today that seeks to map the brain in unprecedented detail.
We probably know about 1% of what the brain is doing. The brain is incredibly complex, has 100 billion neurons, untold trillions of connections. So particularly when it has to do with higher cognitive functions like feelings and thinking and emotion, we really do not have a very good understanding of that.
At Massachusetts General Hospital, doctors are using a surgical technique called deep brain stimulation, or DBS for short, on patients with untreatable psychiatric disorders, including a severe form of OCD.
What do you feel?
A 7.
A 7? Okay, can you put an adjective to it?
It's a happiness.
Okay.
While surgery is not without risks, doctors say DBS is largely reversible. A pacemaker-like device is implanted with wires that send electronic pulses into targeted areas of the brain. It has successfully controlled tremors in Parkinson's patients and has been tested on patients with untreatable depression.
But at first,
this video came out, I don't know when, I think this came out like 4 or 5 years ago. I don't think they had enough, and this may have been an old video. I think that they don't know about Neuralink from Elon Musk, because I'm pretty sure that would have been in this.
first met Liz, her affect, or the way her face looked, was just very blank, very sad, even had trouble making eye contact.
Liz Murphy's anxiety and depression had become so debilitating that one day she just got up and left her job.
Walked out and I never went back to the office.
So I totally know exactly how she feels. The anxiety gets so, and it's hard to quantify in words, like how anxiety feel when you're feeling it, because it kind of feels like you having a heart attack or something, but you're not. Mine is actually getting better. Mine actually was induced by too much alcohol. I stopped drinking alcohol and they like went away immediately. No more anxiety. But I only had anxiety while I was drinking, so they definitely linked together.
Office and just went off the grid totally. I was just a complete shutdown.
The charging, it's fine.
In 2006, Murphy became one of the first patients to undergo deep brain stimulation surgery for depression. The surgery lasted 8 hours. Once the electrode was implanted and turned on, the doctors delivered a small amount of electrical stimulation.
Then finally I felt something, and it was
just looking at this damn video.
It was remarkable, actually. Within 2 to 3 months, I started walking my dog again. Being able to get out of bed in the morning and getting showered and dressed, and they sound like small things, but I didn't do those things very well.
Our goal is to make very sick patients better. So if we have a safe therapy that takes someone that is so depressed that they can never leave the house and give them their life back, how can you say no to that?
While Liz Murphy was helped, some other results for depression have been less promising. Doctors are now in the early stages of experimenting with a new, more advanced device that responds to each patient's mood.
We realize we're on the cutting edge.
Okay.
of these treatments for psychiatric illness. And because of that, we're extremely careful. There is a dark history of psychiatric neurosurgery. It's now been almost a century ago, but it still overhangs our field. But I really want to emphasize how far we've come.
Our challenge, I think, as a medical community is to not get over-involved in the fact that it's psychosurgery. Let's try to evaluate it scientifically as best we can.
Well, thank you guys, man, for staying with me long enough. Well, we went from lobotomies to, I think that was called DBS, brain implants, pretty much. It's just so, it's a blessing to come from lobotomies to this type of situation, and medication management, and tongue twister, that we can actually live lives now, and lives are being changed. So my mind just thought about this, and I just wanted to do a deep dive into it. So I am Nurse Akeem, and I am a Psych NP in the making. And if you like this type of content, show me some appreciation by hitting the like, subscribe, or whatever you want to do. It's all up to you. And if I get like a large following on this, I'll do more of these type of videos. And just go down in the comments and tell me what you want me to see, Till next time. Thanks. Peace.